this committee, and I want to welcome everyone to the third meeting of the Committee on Accelerating Progress to Reduce Alcohol-Impaired Driving Fatalities here at the National Academies of Science, Engineering, and Medicine. I think, as all of you know, this project is sponsored by the National Highway Traffic Safety Administration. Around the table, you'll see my colleagues who are members of the committee, and they'll introduce themselves in just a moment. But just a few of our usual words about the nature of these meetings. This is an open, on-the-record session, and interested individuals have been invited to attend as observers, and the meeting is being webcast as well. This is an information gathering session. As I think most of you are aware, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. So please be mindful that the committee itself has not come to any conclusions, and you shouldn't leave here today with the impression that we have. The comments made by individuals, including members of the committee, should not be interpreted as positions of the committee itself or of the National Academies. And the committee members will be asking lots of questions, hopefully probing questions that will enlighten us, but they will likely be also asking questions that don't reflect necessarily their point of view, but are just designed to elicit information or perspectives. We will be working diligently over the summer and into the fall to draft a report. We anticipate that report will be released sometime in the winter of 2017, hopefully not sliding over into 2018, but one never knows. Once the report is drafted, it goes through a rigorous process of review by an external group, which is anonymous to the committee. It's up to the committee to respond to the comments and provide appropriate revisions that ultimately must satisfy the National Academy's Report Review Committee before it is considered an official report of the Academy. This is the third information gathering meeting, and in addition to the information we've heard in prior meetings and will be hearing today, the committee has reviewed information relevant to its charge and will continue to gather additional information over the course of the studies. In terms of format today, we look forward to speakers' presentations, and we will follow each group of presenters with a question and answer period, primarily focused on clarification of fact by the committee members. And if we have enough time, we'll open the floor to allow attendees to ask additional questions. We'll have a brief period of time at the end of the day for public comment, and those who are here, as well as viewing on the webcast, will be able to make some brief comments if they wish. We'll ask each speaker to please disclose whether they receive any fundings for activities related to the topics and the sources of those fundings. And for more information on the study, there is a project website, and that's available in your attendee package. The staff is here today, and if you have any questions on logistics or other issues, please contact one of them, and hopefully they'll be able to resolve your issue. As I indicated, this is being webcast. And at the end of the meeting, presumably in a week or two, the presentations will be made available, as well as the videos on the website. There are three committee members who are not here at the moment. Jeff Niederdeppy, Ricardo Martinez, and Doug Wiebe. Jeff and Ricardo are going to be joining us by webcast. Carrie Keys is going to be joining us momentarily. But so you know who everybody is, I will ask the committee members to just introduce themselves with their names and affiliations. As I said, I'm Steve Teutsch. I'm at UCLA, USC, and the Public Health Institute. So Joanne, why don't we start with you and go around and let everyone introduce themselves.
Thank you, Steve. Good morning. I'm Joanne Tomka. I'm Program Counsel with the National Association of Attorneys General.
Good morning. I'm Julie Baldwin. I'm at Northern Arizona University, the Director of the Center for Health Equity Research.
Good morning. I'm Tim Namey. I'm a physician investigator at Boston University and Boston Medical Center.
Good morning, Linda DeGutis. I'm the Executive Director of Defense Health Horizons, which is sponsored by the Henry M. Jackson Foundation and based at the Uniformed Services University.
I'm Kit Delgado. I'm faculty in emergency medicine and epidemiology at the University of Pennsylvania.
Charles O'Brien, Professor of Psychiatry, University of Pennsylvania.
David Jernigan, Associate Professor at Johns Hopkins Bloomberg School of Public Health.
I'm Jody Sindelar at Yale University, a health economist.
Great. Well, thank you. So there are brief bios if anyone is interested from each of the committee members as well as the speakers in your materials. So feel free to peruse those. So let's move to our first panel, which will be on the insurance industry perspectives. We originally had 3 speakers. We're delighted 2 of them are here today. Unfortunately, Rob Strasburger from the Auto Alliance was scheduled to talk about things from the automotive industry perspective, a perspective which we certainly need, but he won't be able to join us today as he had an emergency come up. So he offered to provide us some information offline, so we look forward to hearing from him, but unfortunately we won't be hearing from him today. On the other hand, that liberalizes our time for our 2 speakers who are here today. So we'd like to welcome both of them. Jessica Sugino is rejoining us. We appreciated your presentation at an earlier meeting, and I'm glad to have you here. Ms. Sugino is the Vice President of Research at the Insurance Institute for Highway Safety. So we'll hear from her first. We'll follow that with Brooke Stringer, who's the Financial Policy and Legislative Advisor for the National Association of Insurance Commissioners. So thanks to you both for being here. Are you ready?
Steve.
Hopefully, yes?
Steve.